recommander mon intervention, il va faire dans l'anglais, parce que c'est ça, il est bien articulé. Ça, c'est mon premier, avant, il prend le français. Ça, ça va permettre moi de faire l'anglais. Oui, merci. I am presenting the Director General of WAHO, and WAHO is the West African Health Organization, the health institution of ECOWAS. The DG would have loved to be here himself, but due to equally important meeting, he's asked me to represent him, so I'm speaking on his behalf. Now, on the topic for discussion, we say what are the key environmental and economic risks affecting the distribution of health products across our region. WHO in 2016 had attributed 24% of all deaths worldwide to the environment. And these factors actually included air pollution, water, sanitation, increasing heat waves, and severe weather events. Of course, harmful exposure to certain chemicals, and especially mercury and other arsenic products that aligns to the land evacuation. Now we may call it a calamity that is going on globally. But for the region, we have added factors beyond the global issues. And those would find them in the various landslides that have occurred, taking typical example, the one that occurred in Sierra Leone, and we also look at floods in Ghana and other areas, fuel explosions in Sierra Leone, in Nigeria, and again in Ghana, and bushfires, and then the great aspect again that actually have impact on us mostly is tourism and conflicts. And this have actually displaced a greater number of the population from their normal locations, thus creating the risks of instability, peace, and development and growth within the sub-region. And this has actually caused the displaced people moving far from where they belong and where they normally know, and then reaching them to be able to support them with health needs has become an issue. And therefore, you can actually also talk about the risks associated with the healthcare workers themselves who will have to reach or deliver health products to this population. The interruption, the fear, and of course leading to reluctance of our health personnel providing health services to the people effectively. As such, during the height of the COVID-19 vaccination, strategically, applications of the single dose vaccines like those from Johnson & Johnson came actually as convenience. Giving a typical example for Burkina Faso, the country in which I live, and which I was monitoring, and I was part and parts of the regional vaccination outcomes, noticed that the single dose helped in reaching out to the individuals in the northern part of the region where most terrorist attacks were. Because you provide the service today, the next day you may not find them at the same location. So that was what made it possible for us to reach out to them. Bad roads and limited transportation facilities, the risks of crossing water bodies to reach the remotest community, thus posing environmental risks to the service of the providers. And the one sad event which I witnessed myself in Benin, where we had gone for this anti-malaria chemotherapy prevention therapy for children under 5. We went to 9 districts and the remote areas. We had spoken to some of the health workers, and the next day some of them have to reach out to further to other remote countries, vicinities. And then the next morning, we received a message that one of the colleagues we had just spoken with had died because they drowned in the river. It was then a rainy season. So you can imagine the impact. It was sad. It discouraged a lot of the other staff who were to also move along to do most of the work. So there are risks both for the population as well as the healthcare service providers themselves. So that occurrence may not have had only in Benin. You get it also in the front plains in Ghana and many others of countries in the sub-region. So there are also limited infrastructures for storage, incinerators, to dispose of waste products or expired products, especially the strange needles which have to be incinerated, are burnt in the open air. And that you could tell the consequences. When they're not really burnt off to melt off the metals, kids around goes on to pick it up to play with, and then it also may cause other health disasters, either contracting the diseases for which the strains were useful, and that also would cause environmental risks to the population. So we can actually say that the risks associated with environmental problems have immense health impacts, and that requires a combined expertise and evidence to estimate the environmental burdens of the diseases that we all encounter, which therefore requires the quantification of the amount of disease cause attributed to these environmental issues we are discussing, and of course also the impact on the economy. And then also looking at the opportunities that could actually be created to prevent some of these impetus. It's as a global effect, and then of course encourage the preventive mechanisms that needs to be applied to policy availability. Are they enforced? Some countries may have the policies, but the enforcement is a problem. The others may have strategies and other interventions and technologies, but are they being implemented? That is where we have to look at. So I think this meeting, as from yesterday, had spoken various interventions and strategies that people are using in their countries, which are worth learning from, as benchmarking and sharing ideas. But the most important thing is the solutions will have to mitigate the risks that, whether economical or environmental, to be able to address the needed issues that we have. There was a typical example of the technology in the using of the drones, which of course we have seen that in Ghana, which I've also experienced in myself. So I know the benefits of it, but how are we applying it? Because it has a cost implication, and then also the training and capacity developments that will have to go in. So if we should integrate this aspect into the supply chain distribution pattern, somehow it will work and work effectively, but then are we ready to invest as a government or as a people? So that is where we have to look at. ECOWAS, since its creation in 1975, is gradually actually seemed to be moving its focus from trade and cooperation and extending its mandate into political and security aspects due to the increase in civil war and failed states. There are a lot of coup d'etats, a lot of problems that we personally are experiencing that are affecting development. Now, some concrete efforts have been made in this regard by ECOWAS since 2008, particularly in the development of the ECOWAS conflict prevention frameworks for the progressive economic integration and conflict prevention and management in the member states. But the enforcement is a problem because the countries know, yet the next day we hear coup, the next day we hear conflict, there's terrorism everywhere, and then we come back to stand one, investing and investing, which wins off the natural resources as well as also the income and funds that have been generated to move forward for growth. And any more interventions across the countries, customs and procurement policies, besides the ECOWAS protocol for free movements and of people and goods within the region, are they being enforced? Are these conflicts being addressed? So it really that if you realize, and then of course diseases like COVID-19, which we have to restrain our movements and affecting businesses and all that. So definitely we are faced with issues within the continent, and then particularly with West Africa. ECOWAS again also tried to do the common external tariff regulation to amend all products that, particularly in the pharmaceutical sector development, to attract zero tariff for raw materials and equipments and packaging materials to aid and reduce the cost of medicines that are produced locally. Some countries abided by the protocol and implemented, and some have still not done it. So it means that again also affects the economy and also poses risks to availability of medicines and the costs. And this will give ways to counterfeit medicine, because if locally produced products that we can have regulatory oversight on them are more costly than those that are imported from elsewhere, then becomes an issue where we cannot be able to look at. Weak regulatory systems are being strengthened currently because most of the regulatory agencies have actually strengthened the capacity. The regional joint assessment harmonization process have also taken off. Web portals and ECTD, moving from the paper common technical document, has been improved. A lot of work is going on to improve access to quality medicines, but it is not enough because we need to have planned, order structured, well integrated, and actually awareness that needs to make it possible for procurement officers to know what's being done by all sectors, and then also to be able to purchase what is produced locally so that you can have a lower cost and then help the people within the far-reached areas. The economy we know shapes and health insurance, healthcare systems, health outcomes. Most countries are not supporting the health insurance systems, and those who had started effectively also moving down the drain because of change in politics, change in governance, and change with ideologies, and that has also caused problems. So the very livelihood of people and those that could help through the insurance system, are now paying out of pocket. So it means that we always have to depend on partners. We have to get ourselves with other donors who are actually making provisions for. And the government itself, support is very limited. And health finance becomes a problem both for the rural and sub-rural communities because they are not able to afford what it's supposed to do. And probably the systems on which we operate as well, because the governments and the market failures, as well as the traditional method of financing healthcare, is also not working well. Over reliance of donations and support from donors has become the order of the day. So we have to also look at sustainability and also continuity of our external supports, which the governments will have to ensure that these aspects rather look seen as a lower component and the government's interventions be increased. The region will continually find itself in a high economic risk if the government themselves do not take responsibilities to support the distribution and supply chain effectively as needed. So in January 2021, the government of the Head of State Summit in Niger actually commented on the fact that there's a need to establish a pool procurement system, and then they established a revolving fund for the pool procurement system. And up to date, even though we were established in 2021 April, no government in West Africa has invested. And it's an issue which we need to address before the next pandemic should ever happen to us again, or else we'll find ourselves in the same situation for which we experienced in the COVID period. So I want to say that this meeting should not be like any other meeting that we've had over the years, but rather it should be able to provide the strategic recommendations to government and leaderships to be able to implement and enforce some of these recommendations that we've come out with during this meeting to be able to support it. And I want to show that WAHO is ever ready to help, to implement the initiatives and also will integrate it with these member states to achieve the common goal instead of duplicating of efforts within the sub-region. I want to say thank you for listening.
Merci.